Now to an I-Team investigation into little-known fees that mean huge costs for traumatic injury care. The I-Team has found the rates for trauma alerts and those huge fees that come with them are growing faster than Florida's violent crime rate and elderly population.
And as I-Team investigator Ann Maxwell shows us, for-profit trauma centers charge the most in our area, as much as $35,000 just for being brought in during an emergency, compared to non-profit trauma centers.
It's something that can happen out of nowhere.
It scared me to death.
An emergency trauma call.
Well, when she hit us, it was over with. I don't remember nothing.
John Farah and his partner Ruth Ann Robinette were rushed to the trauma center at UF Health in July after a T-bone crash flipped their truck multiple times. A trauma team was alerted to stand by.
Just as soon as we came to, the ambulance was already there.
Robinette received x-rays, scans, muscle relaxers, and acetaminophen. Farah received x-rays and scans as well, plus staples in his head and stitches in his arm. They reached out to the I-Team after getting their bills. More than $47,000 in charges for Robinette, and Farah, who does not have health insurance, got a bill costing about $150 more. Both their bills came with liens.
You get a wake-up call whenever you get hit by somebody, and then they go charging you these kind of outrageous prices on.
The I-Team reviewed their bills and found the biggest single charges were for $11,000 trauma alert fees, which cover the cost of having surgeons, nurses, and equipment standing by ready to assist in the most critical cases.
That activation fee isn't regulated, and it can be whatever the hospital wants it to be.
Dr. Nicholas Namias, who's the chief of trauma at the University of Miami-Jackson Memorial Hospital, says the cost to run a trauma center in Florida shouldn't vary much because they all have to meet the same standards. Studies show for-profit hospitals charge the most. While nonprofit UF Health charges about $11,000 to activate its trauma team, for-profit Orange Park Medical Center charges about $35,000, and for-profit Memorial Hospital charges $27,000 just for being taken through the doors of their trauma centers. But trauma patients don't get to choose where they go, and data shows the number of patients charged for trauma alerts is rising faster than Florida's population, even as violent crime is trending downward.
Motor vehicle crashes, falls from heights, gunshot wounds, stabbings. Those are what trauma centers are really meant for.
Now, falls make up a significant portion of trauma alerts. In 2021, data reported to Florida's EMS tracking and reporting system shows slipping, tripping, stumbling, and falls accounted for more trauma alerts than any other designation.
Falls from standing are a serious thing, but I don't think they all require trauma centers.
Trauma alerts are triggered by paramedics. Leon County EMS Deputy Chief Mac Kemp says they follow strict criteria, and the patient is always the priority.
Because you'd rather have the team there ready just in case they needed it than not have the team there.
Trauma centers used to be seen as money losers, but with the advent of trauma alert fees 20 years ago, they were able to become sources of revenue. As more trauma centers have opened in Florida, data shows more trauma alerts are being called.
So instead of splitting the pie has just expanded.
Public data analyzed by healthcare economist Etienne Proct shows the number of people who received trauma charges and were released the same day, like Farah and Robinette, nearly doubled from 2015 to 2020.
If we look at trauma services as kind of a public health concern, then we want to find other sources of steady funding for those hospitals. If, on the other hand, we want to look at it as a revenue-generating service, then we should get used to the system as it is now with these kind of large trauma fees.
There are 4 trauma centers in Northeast Florida, and publicly reported data shows there's a big difference in how much money they make. Overall, nonprofit UF Health lost money in 2020, while for-profit hospitals with trauma centers owned by HCA Healthcare raked in big bucks. HCA-owned Orange Park Medical Center made $57 million in profit in 2020, and HCA-owned Memorial Hospital made $96 million. And their profits ballooned after they opened trauma centers. Public records show Memorial's profits grew by about 40% from 2017, when a trauma center was opened in May, to 2018, going from $38.6 million in profit to $64 million. Orange Park's profits jumped by a third from 2016 when they opened a trauma center in May to 2017. Both systems have continued to see a rise in profit year after year. A spokesperson for the hospital said over the past 5 years, both Orange Park Medical Center and Memorial Hospital have added new services and greatly expanded their footprints, saying, quote, trauma care is part of that, but certainly not the only part. However, they declined to point to specific examples in the years where their profits jumped after opening trauma centers.
By definition, it has to be money making, or the for-profits wouldn't be in it.
Robinette and Farah worried about losing everything when they got their bills. Their dream of buying land in the country and making a home there seemed suddenly out of reach. A bill that hit them out of nowhere left financial uncertainty long after staples and stitches were removed.
How would you like to wake up and see a bill for $47,000 not knowing how you're going to pay it?
Billing experts tell the I-Team these huge trauma alert fees are also driving up insurance costs. The good news for Farah and Robinette, they were relieved to find their bills had been paid in full when they went to pick them up earlier this year to share with the I-Team. They were covered at least partially by auto insurance. UF Health hasn't commented other than to say trauma alerts are called by paramedics at the scene of an incident as per state regulations. A spokesperson for Memorial Hospital and Orange Park Medical Center says the fees they charge are used to cover the cost of running their trauma centers and that the fee is waived for the uninsured and patients with insurance won't be charged out of pocket for them. I'm Ann Maxwell, Channel 4, the local station.